think your sound's on, not on just yet, but it will be. You look nice. I know you can hear me. Denise, can you hear me?
Okay, and now I can hear you. Trying to get back to the screen where
Oh,
you're.
perfect.
Now I can.
And let me make sure I'm recording over here, which I am. Denise, welcome. You're back. I can see you. You look really nice.
Thank you.
Welcome to Buckle Up Podcast Universe with Brandon Rush, myself, my mom, Mama Rush. She's here via her headshot.
Hi,
Hi,
Denise.
Mama Rush. Hi, how are you? Thank you
Fine,
for having me.
Denise. Welcome. We're
Yeah,
so happy to have you on the show today.
very excited to have you here, Denise. I appreciate you making time on a Sunday of all days, because I know you have a busy schedule coming on to the show. We appreciate you.
Yeah, I do sometimes, but I can always make time.
Oh, hey, we appreciate it, Denise. So as I said, welcome. We're doing really well right now. We have 6.3 million viewers/listeners in 17 countries and 6 continents. So we're happy to have you tell your story on here.
Yeah, that's exciting news for you. I'm glad that it's going very well for you.
Yeah, no, thank you so much, Denise. I looked at what you sent me. So you've been 16 years as a nurse practitioner, or were you?
16 years as a registered nurse and 5 years as a family nurse practitioner.
Holy smokes! Congratulations! Like that's thank you for your service.
Yeah, it's been a long journey. I've learned a lot along the way, and I came here to California 5 years ago. I
Okay.
was in Florida for most of my nursing career, and I came here 5 years ago on a journey. I only had my suitcases. I had to leave my kids behind to try to experiment out here and see how it would go.
Yeah.
And right during that time is when the pandemic hit. So
Oh
that was an
wow.
interesting journey and introduction to California.
Yeah,
I passed
definitely.
and I passed my boards here and eventually ventured out to, starting out my own business while I was also working as a registered nurse, which that was a journey in itself.
Yeah.
And eventually motivated me to continue on into writing even a book about my experience as a nurse practitioner, which a lot of people don't talk about nowadays.
Okay. Well, we're gonna get into it. Let's get all the way into it then. So let's talk. Well, let's mention your book. Let's mention your book for starters. Let's go there.
Okay. With the Unfiltered Nurse Practitioner, basically, when I became a nurse practitioner, it was during the pandemic.
Okay.
And it took several months for me to get my license. And no one prepares you for the stuff that you encounter. Being a registered nurse is one thing, but then transitioning as a family nurse practitioner was another world.
Yeah.
No one tells you that although you see new graduate positions, you can't get them most of the time, or it's very difficult to get that because everyone's competing for it.
Really?
Adding a little bit of the pandemic of COVID, a lot of these clinics were shut down. So I had to be very creative in how to get my experience. So at first I would take any gig that I could.
Yeah.
1099 contracts, I would run the COVID lab clinics. And then eventually I took a position as a full-time nurse practitioner and saw the other side of medicine that wasn't so pretty.
Okay.
Me and my colleague at the time realized that they seemed to be, some stuff that may have been even illegal, like from upgrading on billing and coding, the stuff they don't really go into a lot of details when you're being trained, and you can easily put your license in, at risk. So
Yeah.
I decided from there, after seeing, all the trouble that it was working for someone, I wanted to practice real medicine, as my collaborative doctor explained to me. So I had this crazy idea after someone talked to me and said, "Hey, you have an entrepreneur mindset. Why don't you just venture out into doing something yourself?" I
Yeah.
had no clue how to open a business at all.
Okay.
All I had was like Google and YouTube. And I was
Yeah.
trying to see if I could find the information. It was very difficult. And I was also feeling a little unmotivated because anytime I was taking any type of gig, nurse practitioners don't have like a mentorship that's very
Really?
strong
Uh-oh, you
for
froze for
them.
a second.
Doctors do. Doctors have residency and years of doctors have years of practice before they jump out and treat patients.
Yeah.
Nurse practitioners, the minute you have that badge, it's like you're ready to go.
Sink or
There's no
swim.
training. I remember they would just give me the keys. Here you go. Here's your MA. Run the
Wow.
show. You're good to go. So as you can imagine, no one prepares that it's going to be that that jump right in.
Yeah, with
So
nothing.
that was nothing. So I said, okay, I am having trouble finding jobs that I really want to do, because everyone wants either 2 years of experience or greater. But how do I build experience when no one's willing to give me the experience? That was the challenge I faced. I said, okay, I'm opening my own business, and then I'll contract with smaller companies, present myself as Now Med Clinic. I also got sick during the pandemic. So the reason why I ended up with 2 businesses at that time is because once I got sick, I knew a little bit about vitamin therapy in the past because of personal experience when I was younger. So I went into a clinic and I said, hey, can I get all these 5 injections? And they looked at me like I was crazy. And I went and I told them, don't worry, call a doctor, they'll allow it. And I felt so much better in like 24 hours. And I said, I wonder if I can order this stuff for myself now that I'm a nurse practitioner. And when I called these compounding pharmacies, they were like, well, you need a business address. How do I get that? And I started venturing into how to get an office space. It wasn't meant to go into a business. It just slowly unraveled into it. Because then I was like, well, if I helped myself, can I help others? Because the pandemic was very scary. So that's how I ventured into having 2 small 87 square feet offices in Fairfax. I worked with it. And then eventually moved on towards a bigger space in Woodland Hills. It was Miami Cocktails and Now Med Clinic. So I had a lot of fun doing it. I think the challenge came in is you learn a lot about business once you jump in it. Marketing, the barriers financially, all the the legal stuff that you have to look into. No one really has like a step-by-step guidebook on it. And there's some stuff also as a nurse practitioner that people don't talk about. Anytime I would look at videos, I was finding videos of nurse practitioners quitting the profession in less than a year or feeling burnt out. So that's why I didn't want nurse practitioners to feel that they have no options. You studied this hard for your degree, so you might as well find a way to be creative and make your own path. And that's what I did. And that's what led me to getting experience, to be honest. And that's why I'm where I'm at today.
Amen, Denise. That's extremely impressive that you had that the entrepreneurial spirit, but because no one showed you how to do it, they just threw you out there basically. You came up with your own way of figuring out, and it was kind of like, I guess, trial and error. Would it be? I guess you're saying?
A lot of trial and error. Like I said, I had no idea where to start. I look into things like, LegalZoom. I was researching a lot. And then I realized, okay, I'm in California. I need a doctor. I can't, practice independently here. Some states you can. So that's a lot of the stuff is the learning curve when you go into this profession. I found my collaborative doctor actually through Indeed. I was interviewing, I found myself interviewing doctors, which was really weird for me. So I was going through the identity shock and transition of being a nurse and now being a nurse practitioner, looking to hire a doctor. And I didn't have a bunch of income. I'm a single mom with 2 kids. I was like, how am I going to do this? But I just rolled with it. All my life, I just learned that you have to take a chance. You won't ever make it to anything if you always have fear hold you back. And I didn't want to be held back by fear.
Absolutely.
So I ventured out. I found my doctor, an amazing physician with 40 years of experience. He was so impressed with me and what I really wanted to do that he actually offered to help me without even getting paid at first. He just didn't want it. He just wanted to give back, and he said, I want to help you because you want to practice real medicine, and that's what I support.
That's a blessing. I mean, that's an absolute blessing that you were able to find that person. I mean, that's a godsend almost.
I prayed on it. I wasn't sure. So a lot of times, I ask, I put things in writing. I don't know how it's going to happen. You probably see a vision board behind me. That's what that is.
Oh, I didn't know I love vision boards, and I didn't know that you had one behind you.
Yeah, I put stuff also that my kids, have given me. They're teenagers now, so I have to enjoy the moments when they used to write the cute things for me to post on a wall. But the vision board for me keeps me focused, keeps me on my goals, and I act on faith. You have to have faith in yourself first, of course, and faith in whatever you do have faith in. And for me, I always put, my faith first, and I don't let fear hold me back, and I just move forward. Either it's going to work or it's not going to work.
Absolutely.
Or if I fail, I'm going to learn something new. That's the way
absolutely. Amen. Denise, it's with the vision board that you mentioned. It's interesting you mentioned that because when I first when in 2017, I decided to go out there building my career in New York. I'd already done it in Los Angeles and Miami and Atlanta. I'm like, hey, I'm going to go to New York and do this. I literally created a vision board. I put the shows, I put New York City on there, and then I put all the shows that I wanted to be on that vision board. I ended up in my first 5 weeks, I ended up auditioning for all those shows, and I'm actually on all those shows now. So,
Wow.
but it's now it didn't happen overnight with that. It took
years. It's not overnight.
Yeah,
there's certain things I haven't seen yet, but I mean, it will sneak up on you before you know it. All you have to do is take one step at a time in life. You don't have to have all the answers.
Absolutely.
You just have to have resilience, a little bit of stubbornness too.
Yeah.
Because I was told, I think what motivated me more to do my business at that time, where I had the office and I did a grand opening, was because I was told I couldn't or I would fail. I had doctors look at me straight in my face and tell me, oh, you have that itch to scratch. I'll let you scratch it. You'll be back.
Yeah.
And
oh, wow.
They still check up on me and they're like, oh, you're still doing
here.
that.
Yeah, you're still here.
Actually, I give business to one of them. It's
Good.
funny.
Good. You know what?
Just to show, you know?
Yeah. That is such a... Sorry, Denise, I didn't mean to cut you off. I had to make sure I didn't cut you off.
No, you did. Go ahead.
Denise, that is such a motivating factor. I love her to death, but she's gone now. But my grandma said that I couldn't be an actor, for one. And I got so upset. I used to eat dinner with them when I was in college at University of South Carolina before I graduated. I used to eat dinner with them every Wednesday. And so one of those Wednesdays, my grandfather's a bishop. One of those Wednesdays I went to, I was sitting there, we were waiting for my grandfather to get back there. And I was watching TV and I was like, hey, Grandma, I want to be that thing on TV. And she's like, what's that? I said, I want to be an actor. And she's from the super South. So she's like, you can't be no actor. And I got so super upset. And I went outside and I called my mom. I was really upset. I went outside, called my mom because I had to calm myself down. Just like being upset about someone telling me I couldn't do something. And my mom said, baby, you can be anything you want to be in this lifetime. And so after I graduated, I went out there being an actor in Los Angeles. And sure enough, I've been successful at doing it. But it was that initial drive of her telling me that I couldn't do something that got me to go after it as big as I did. So I love you saying that. Not only that, with this podcast, I had asked a friend, I was talking to a friend about it, and that friend told me I didn't know what I was doing, that I didn't know how to interview people, that that I wasn't doing a podcast. Said all three of those things. In 5 days, we hit, 1.2 million listeners/followers. By day 10, we were at by day 18, we were at 4.4, and then now we're at we're at 6.2 or 6.3. But I wanted to prove to her, like, hey, you know what? You don't know what you're talking about. Don't put me in a box of telling me I can't do something. Just like those doctors tried to say, oh, you'll be back. No, you went out and you proved to them that you're able to do this, and you've been able to do it successfully, even to the point where you're writing a book now, which I'm so proud of you. And so I love meeting like-minded people. So yeah, I am proud of you. First off, like, you did that knowing that you probably cried tears behind the doors that we don't know about. You probably had a lot of battles.
Even to become a nurse practitioner was interesting because
Tell us. Yeah.
I prayed on it. I didn't know how I was going to do it because I was working full time, a traditional schedule of Monday through Friday with occasional weekend shifts. I was a case manager back in Florida, where I was working as a nurse, and I saw an opportunity to pitch something to the CFO of the hospital.
Oh, wow.
Because I noticed there was a problem with retention issue. And I knew that if I wanted to pursue the nurse practitioner, because the first thing I said is, well, if they accept all my credits, I'll take it as a sign that God wants me to go down this path.
Amen.
And I said, that was impossible because it was about 6 courses. And I said, well, God, if you want that, that's the only way I'm going to go into it.
Amen.
And then I get a call from admissions and they're like, you know what? We transferred all the classes. I've never seen it happen before. I said, okay, now I have barrier number 2. How am I going to do my clinical rotations working Monday through Friday when clinics are open, on the weekdays mostly?
Yeah.
So I said, well, the only way I could see doing this is if I pick up weekends, but even then I'm still missing a day. I have to crunch in 40-hour work schedule, 16-hour clinical rotations, plus schoolwork and 2 kids. So how am I going to do this? Yeah. So I went and I pitched to the CFO, hey, I noticed you have a retention issue in the hospital.
Denise, you froze for 1 second.
How about you do 10-hour shifts?
Denise,
I noticed
we go
there's,
back.
an issue or after. Oh, did I?
Yeah, no. Denise, we go back.
I mentioned to the CFO that I noticed. Yeah. Oh, Which part did you miss?
You said you went to the CFO. You went to CFO with retention area. Start from there. I'm sorry, it froze for a second.
Yeah, no, it's okay. I went to the CFO and I told her that I noticed there was like a retention, issue in the department, but a lot of times it's because of the schedule. And I noticed the sister hospital had 10-hour shifts. And most of the discharges, because of the doctors not always being from our hospital, would come in the afternoon late, and then these patients couldn't leave until the next day. I said, look, financially, you're going to see a change in your revenue. We'll be able to discharge more patients if you do 10-hour shifts. You'll have a retention of your employees, and everyone will be happier. You'll save money on both ends. And then I can finish my clinical rotations, because I told her I'll be the next one to leave. I'll find a way. And I didn't think anything would come of it. I was a little nervous to write, a daring email. I did. She responded. It took a few weeks. Me and my colleague, one of my other colleagues, were the first ones to do a pilot program. And that's how I was able to go through the nurse practitioner.
Look at you, Denise. Look at you. Fortune favors the bold, and you have it. And because you it seems like you're a God-fearing woman, and like you are you lean by faith too, and like it's guiding you.
Yeah. I put it out there. I said, what's the worst they're going to do? They're going to say no. And I really feel like if something's meant for you, you just push it, and you can't be afraid to knock on doors. Because before I came to California, and this is for anyone that's felt discouraged at one point, I moved to Virginia, Fairfax, and I thought everything was going to go well there, that I moved everything from Florida to Fairfax for a travel contract that was supposed to turn into a permanent job as soon as I passed my boards. Well, hold and behold, contract for many travel nurses, because of financial issues, fell through right on the holidays.
Oh, wow.
And I was applying left and right for jobs. Washington, DC, I was applying to Maryland. I was willing to drive. And every door, because it's the holidays, was closing on me, and everything was a no. And I remember my best friend till this day, she is always optimistic, and she said something I never forgot. And she's like, oh, that's good, Denise. I said, what do you mean it's good? She's like, well, that means you're getting closer to a yes. Sometimes all those no's is just one step closer to that yes. You can't give up. You just keep moving forward. Don't accept no as an answer. No matter what. Maybe you have to reevaluate what you're doing, but if that's really what you want, do not let anyone take that away from you. You keep moving forward. And I never forgot that, ever.
Yeah. Denise, I relate to you on so many levels, which I appreciate. I know that my mom probably does too. She might be a little bit silent right now, but she's listening, taking notes and everything. Because we're from that Virginia area that you mentioned, all that. My mom, I think, just worked in some of those territories over there when she was.
Yes, I did.
Yeah, so I was torn when it didn't work out, but then this path opened up for California, and it was without a license on hand, which in the nursing world, when you apply for a travel contract, you have to have, especially for California, you have to have the license. It takes months for the license.
Okay.
This guy had some faith in my resume, and he said, you know what, let me submit you to California. And I was like, they're not going to, and he's like, let me submit you. What do you have to lose? I said, no, you know what, you're right. I let him submit it. That same day I had an offer for a major hospital here, and I told them, I was like, hold on, I don't have my license on hand, right? And she's like, you're worth the wait. And that's when I said, okay, this is the path for me. California is the path for me. So I came here with I'm telling you, just my clothes, because I lost everything that I had in Fairfax. I could not afford to even bring furniture, all the stuff that I had lost it all.
Oh my gosh. Dude, you were a story of triumph. Sorry?
Yeah, it was a journey to get here. It was not easy, when you start from scratch.
Yeah, and still you stand.
Yeah, it's still with journeys. You still have barriers. You still have things that you face. Like I wish I could do, like right now, I had to make a decision back in, what was it, like 2 years ago?
Okay.
To go more online, because now I do now MediClinic online. It's focused on, like the veterans.
Telehealth and stuff, yeah.
Yeah, telehealth. Now, would I love my own clinic? Yes. I still work in a clinic as a pelvic pain specialist, and I love what I do there. But I still have that itch still for my own. But I chose to own a house in Texas. Okay. That was a priority for me as well, for my family, or even for investment property, purposes. Yeah. But here I am. No matter what, you just step forward, because you never know, life can change like that. So I just live in faith.
Well, first off, that I love everything that you're saying. I wanted to mention the house that I saw. You showed me the house last night. That place looks amazing.
Yeah.
Good for you.
Yeah, I thought I was gonna move back to Texas. To be honest, I was waiting for my daughter to graduate high school up here. Yeah. And then another opportunity came up where I'm working now, and I felt like the cause for, helping people with pelvic pain, especially endometriosis, which hits close to home because my mom suffered from that condition. I said, man, I can't ignore the opportunity to help. This sounds like an amazing opportunity. So I decided to stay in California, but I'm trying to figure out renting out the Texas property right now. That's what I'm working on.
Denise, I wanted to hit on two things. Sorry. I do want to talk about the property, but you mentioned something really important that I want you to talk about. Which you said that your mom had what is it that your mom had and that you're working on right now?
Endometriosis.
Will you go into a little bit for the listeners so they know what that is?
Yeah. Exactly? 1 in 10 women are diagnosed with endometriosis worldwide. This is a worldwide thing in reproductive age. This is something that it's endometrial lesions or lesions that grow anywhere in the pelvic area. Some people have the mindset that it's all in the uterus or fallopian tubes. Sometimes they get their uterus removed and they still have pain. The pain can present as early as the first period. Girls sometimes may miss work or school. They're in a fetal position in pain, having nausea, sometimes bloatedness, and everything's dismissed because women are always in pain. So it's something that's often missed, sadly. And I see these women sometimes 10 years, 15 years undiagnosed. They go through a lot of gaslighting in the medical system. Oh, wow. It's actually one of the books and projects I'm working on next is on endometriosis to create awareness. These women, I've seen them come as young as 16 years old in a wheelchair. I saw when I was training in Dallas. I've seen them come in walkers at 20 and 30 years old. And right now, there are some treatments out there like excision surgeries, depending on the stage that you're in with the endometriosis. And then there's also like, pelvic floor physical therapy and some injections that you can do as well, which I specialize in doing in the clinic I work in.
Okay. Now those injections, are you able to talk a little bit about what a person, let's say if someone had that and they're like, hey, like, look, they're suffering from that in Los Angeles and they want to maybe come by your clinic. And so would you kind of talk about that a little bit?
Yeah, basically a lot of these patients should be, seen by a GYN. The first steps with endometriosis treatment is getting hormone therapy to try to suppress estrogen. It's not a hormone-driven condition, but it does help tame the endometriosis because the estrogen can make it worse. It's like adding fuel to the fire. Ooh. So what ends up happening with the pelvic floor muscles and nerves is when you have a chronic inflammatory condition like endometriosis, the nervous system is very gossipy, is what I explain to my patients. So everyone likes to think that it's all separate, but it's not. Your body is one. So unfortunately, the pelvic floor nerves get altered. They become very sensitive, like a car alarm that goes off for no reason. Yeah. And that communicates to your muscles down in your pelvic floor. And it creates a tight spastic, pretty much all that is hypertonic now. Okay. So the muscle tightens up, it cuts off circulation. And now the nerve likes to be in a big backyard in Texas, for example. And you got it on the 101 major highway at 5 o'clock congestion time, and it's not happening. Oh gosh, yeah, that's awful. It just creates a cycle where then these people start having pain with intercourse, pain with sitting, walking, standing. You see them even wearing underwears or pants can be very painful. Ooh. And it flares up usually around the time of the month. They also get misdiagnosed often with IBS because they get constipation or diarrhea right near the time of the month. Yeah. But they're not realizing that it's possibly endometriosis. And the reason why endometriosis is so difficult to diagnose and why doctors miss it all the time is because unless it's in a stage 4 or sitting right on the ovary, you'll miss it. There's no real diagnostic test really that can truly catch it on a stage 1, 2, and 3. It's very hard to detect. So sometimes I don't ever like comparing cancer because cancer is a whole other animal, but cancer, we have a lot of diagnostic tests to find. But when it comes to endometriosis, the only true way of diagnosing it is actually through laparoscopic surgery. Looking for it and taking it out. And it's not a forever cure, unfortunately. That's the other challenge.
I have a question, Denise. Sure. Yeah, not to cut you off, but when you were saying different things with you having endometriosis, with that said, can it hinder fertilization?
Yes.
Ooh. That is very important, I think, because
because of the environment. If you think of inflammation,
That's why I had that question. I wanted to make sure that
Yes.
people understand that that can hinder fertilization. I had an issue with that. And
Yeah, that's why I don't have kids. Actually, that's why I actually have kids, but my mom couldn't have more kids. My mom had the condition. It blocked off her fallopian tubes, caused ectopic pregnancies. It hinders the environment in which, let's say you can't get pregnant. Let's say the egg fertilizes, it has to go through the fallopian tubes down to the uterus and implant. When the environment is inflammatory and not ideal, it's more chances of a miscarriage. So there's many ways that endometriosis can hinder pregnancy, and that's why we try to create awareness early and try to get these ladies treated as soon as we can.
Are the injections painful, and where do you give them? I mean, I know you give them in your office, but what site do you do it externally or internally, or how are those injections?
It's ultrasound guided external injections is what we do. Yeah. So it's no downtime. It's a 15-minute procedure. It's something that is done by that one particular company. I don't mention it in more details just because I don't have the permission to market them that way.
You don't have to mention any names. You don't have to mention any hospitals. You're good there.
Yeah, but it's definitely there are a lot of advances with endometriosis. Definitely, you know, it takes a team to treat it. You have your GYN that should be doing the hormone therapy and talking through, you know, the different exams that they should be working you up, like ultrasounds, MRIs, to see if they can detect it. Also then pelvic floor physical therapy, because I kind of compare it to, you have a storm, like a hurricane comes in, right? The storm can go away. The excision surgeon can come in and take away these lesions, but then you have the damage left behind, which is like pelvic floor usually, and we have to restore that back between, like, you know, pelvic floor physical therapy and sometimes injections that are like with lidocaine and anti-inflammatory medicines, like a little bit of steroids to help calm down the nerves and muscles.
Oh, great.
Okay. Great. Denise, question for you. One thing I would touch on. So where are you originally from and how did you end up becoming a nurse? Because I think that's amazing. We have a Buckle Up University, which is helping kids that are 18 trying to figure out, hey, do I go to college? Do I go into nursing? Do I become a doctor? Do I go to the military? So yeah, please tell us.
I love mentoring them. I used to be a teacher for about 2 years for nursing students. That was my side job. So I actually grew up, I was born and raised in Brooklyn, New York. And I left at the age of 15 years old. While I was in New York, since I was little, I always knew I wanted to be a doctor or in medicine. I was a weird kid, always playing with baby checkup and checking out books of, I was checking out medical encyclopedia books and taking them to elementary school, freaking out all the kids. I was way too mature for my age. So that was interesting for me growing up. And then I went to Florida. What inspired me to become a nurse and change paths is one, I had my daughter. I wasn't the greatest with math and chemistry. And that requires a lot of math and chemistry to go to medical school and a lot of years. So when I was actually a patient, I had a complication called preeclampsia. The doctor actually ignored all the signs and symptoms of preeclampsia. I wasn't a nurse back then. I had some medical knowledge to know something was wrong because I did, in my middle school, I did medical magnet program. In high school, I did a CNA program. And after that, I did an emergency medical tech. So I had some knowledge, but I wasn't a nurse. And I knew something was wrong. The doctor ignored everything. He put me in danger. I was re-hospitalized twice after. I could have had a coma. I woke up I was passed out with a high blood pressure and I never suffered from blood pressure.
Holy smokes.
My daughter had a broken clavicle. I had everything go wrong with the delivery. I'm lucky that my daughter doesn't have permanent damage to her shoulder. And it was all because he didn't listen to me. She was 8 pounds 2 weeks early and he ignored all the signs of preeclampsia. And while I was sick laying in that bed, I was 23 years old at that time. The nurses are the ones that spend the most time with you and can actually make or break your care. Because doctors, yes, they're great, but the backup to that doctor is always the nurse. The nurse is the first one noticing what's wrong and can advocate for you. And I had the experience of the good and the bad. I had one nurse, I remember she wanted to put a Foley catheter, you know, a catheter to collect urine. I just had a very traumatizing delivery and I was in a lot of pain there. And I said, I really can't. So she got annoyed. You could see it in her face. And when she came in and she offered me a bed pad. Now, I didn't remember how to use one of these things. You know, usually they help you get on one of these things.
Yeah.
And I was on magnesium drip. No one explained to me that my legs would be weak, and that's why I couldn't get out of bed. I was on bed rest in the hospital.
Yeah.
So she gives me the bedpan. She walks away. I try to get myself being weak on it, and I put it on wrong, and I urinate all over myself.
Yeah.
So I felt awful already that I'm in this position and I can't really do much for myself. And when she came back in the room, she came back annoyed.
Oh, wow.
And when I woke up the second time after being hospitalized was because the doctor then apologized, rubbing my head, saying, "I'm sorry, I underestimated." You know, I had an attorney review my case, and he said if I was in the state of New York, I had pure negligence throughout my care and my pregnancy.
Holy smokes.
And you know, in Florida, you can't sue over that. So there was no consequence to him. It was me that had to live with that consequence and that trauma. And 7 weeks, my daughter was 7 weeks old when I got accepted into nursing school. And when I went to nursing school, I never forgot the first week. Again, I was told to go to the admissions office because one of the ladies there overheard that I planned to work during the program and that I had a 7-week-old baby. And she said, "You need to go to admissions." I said, "For what?" "To withdraw." I said,
"What?"
Yes.
Oh, that bothers me. That bothers me.
She said to withdraw. And she said this in front of others, you know, not even in private, you know, and I went and I said, "Why would I withdraw?" She's like, "The program's too vigorous. You won't survive it." And like I said, I always had this slight stubbornness to me. Tell me I can't do something, and that's going to drive me to do it. Now, I'm not going to lie. It was a lot of triple shot espressos.
Yeah.
Visits to the hospital from probably too much caffeine. But I made it, and I made it with a smile across my face. It took everything in me. But I smiled at her during the graduation. I said, "Yeah, here I am," and I passed. But I always had someone not believe in me. Even the first semester of nursing school, I will tell anyone that's looking into doing something, don't let anyone, even your teacher, discourage you. My teacher, I was struggling with the nursing exam style because nursing, if you go into it, it's different. You have to choose the best answer. There's always 2 correct answers. Oh, really? So I would overanalyze. And the environment that I was testing in was an auditorium on top of it. So I didn't realize that the auditorium is not a best testing environment for me. It's distracting. And I went into the office where there was 2 teachers. One we called kind of like the drill sergeant. She was so strict that everyone avoided her. And then the other one seemed like the nicer one. So I went to the nicer one. They were both in the office. I said, "Look, I've been buying books. I've been studying. I don't know what it is, but I can't figure out why I'm not getting a higher score." And he's like, "Well, there's always next semester."
Oh, wow.
And I told him, "Look, my dad raised me that failure is not an option."
Amen.
So there's no next semester, there's this semester.
Yeah.
So I was a little feisty back then. I didn't know how to be politically correct.
Yeah, I
Back then, the Latina in me did not let me be politically correct at that time. So the other person, the least person that I thought would help me, turned around and said, "Denise, sit down. I have your test. I'm going to help you." And I was like, "Her?" And she realized that I was just over analyzing, that I actually knew the content because she was testing me. And she said, "Have you tested in an auditorium before?"
Yeah.
I said, "You know what? No, I feel like I can't fully concentrate sometimes." She got me my own individual seat and chair all the way in the front away. And she told me, "Get earplugs." And that's where you take the test. I got an A on my next exam. From there on, I was fine. And she said, "You're never moving from that chair until you graduate."
Amen.
It only takes one person to actually have a little bit of belief in you, but you have to, it starts with you.
Yeah.
A pearl in itself about testing. I like that answer you just gave, or that information you just discussed on testing.
And that might be the reason a lot of students have problems, especially in college settings and university settings, when you're in this big old room and you have to take this exam, never figuring out what's comfortable maybe for that student's ability to pass or fail. And that can be in high school, that can be in, as I mentioned, college and universities. So you to bring that up, that's an interesting fact.
Yeah.
So I have
No, it's true, and they don't hit on it. Even when I was learning, what I took from the teachers that I learned best, when I had to teach students, I started doing clinical rotations. That was like my second job. I always worked 2 jobs. That's why my resume is so extensive. You're a single mom.
Oh, Denise, you
So you
broke
have
up
to
for a second.
hustle. There's no, options on that. So
Mhm.
I picked up a second job. Yeah. I picked up a second job doing clinical instructor, and I noticed that these students were different. They were adults working night shift a lot of times, coming
Mhm.
into the classroom the next day, sometimes not like even sleep in
Oh,
them.
wow.
And they were older. They were older,
Mhm.
even as maybe like 50s,
Mhm.
55, late 40s. And their learning style, I had to adapt
Yeah.
to my audience.
Mhm.
I do that as a teacher. So I would tell anyone that's a student is you have to find your style of learning.
Mhm.
It could be auditory, it could be visual. You have to find your way. So for me, I am auditory and visual. So I would
Mhm.
play recordings while going to school. You have to make time somehow. And
Yeah.
that's what I would give as advice to any, student is not get discouraged, but don't take a no from your teacher and keep knocking. There's
Yeah.
someone that's going to help you at some point, but you have to go out there and pursue it. It's not going to come to
Absolutely.
you.
Yeah. I think, Denise, I love the advice you're giving. We're kindred souls, by the way, because everything you're saying too, I've dealt with on so many levels in my lifetime. I had my guidance counselor when I was in high school told me I couldn't get into the University of South Carolina where I went to college at. She advised me not to even apply. And I remember at my graduation, my dad was alive. My dad was like, "Look at you, Brandon. You're a graduate of the University of South Carolina now." And he even said this before he died as well. He said, "You're a graduate of University of South Carolina now, and not only that, you guest speak there all the time because of your accomplishments in the broadcast journalism world and acting world." But that initiative of someone telling you that you can't do something, and what I appreciate about you is that everybody kept trying to tell you what you couldn't do. And here, I'm going to go ahead and say it because I'm going to say it speaking from because I know exactly what it is. A lot of times they're probably even discriminating against you, thinking because you were Latina. I know because I was black, they put me into a certain box thinking, hey, he's black, you can't do this. So I know as a Latina person, brown and black, sorry, I had a hiccup for a second, that you come across these people that happen to put you in a box because they have their own prejudices and their own stereotypes against you. So I appreciate that you had that father, just like I had. The father told you knows not to answer, something along those lines. I think you said.
Oh, he told me, a couple things. Let's see. And he laughs now because he hears me telling my kids. And then
Yeah.
he says,
Mhm.
see, when they become grandparents, they soften up.
Oh,
But
yeah.
when they were raising us, it wasn't
Mhm.
like that.
Yeah.
So with me, I remember I was the only child. So I thought my dad would be like softer on me. But I realized now that he was just trying to toughen me up because he knew the world that was out there. And he
Mhm.
told me, failure is not an option.
Yeah.
Find
Mhm.
a way. Don't take no for an answer.
Yeah.
Mhm.
The one I never forgot as a girl because I'm an emotional goofball. I
It's all
just
good.
am. And I would sometimes cry and I would get frustrated. And he was like, okay, you're done crying? It's okay to cry.
Yeah.
Mhm.
But what are you gonna do about it?
Yeah.
So to this
Mhm.
day, I'll have my moment. You always have a moment in life that life is gonna beat you down. There's always
Yeah.
gonna be something that's gonna get you down. But you cry, and I'm not saying that everybody has to be the same, but for me, it's like, okay, what's in my control? What
Yeah.
can I
Mhm.
do? So after I let out my emotions, I would sit down and write and try to think. Just
Yeah.
like if it's business, that's the way life is. You got to come
Yeah.
up with a plan. It
You
may
do.
not work, but you keep trying, and then open up to others and seek others that maybe would be a positive influence, that maybe have had a similar struggle. You can't be afraid to speak up.
Absolutely. I love your dad. I'm sure your mom's amazing too. And like as I said, everything you're saying is exactly what my parents instilled in both me and my brother. The fact that like, because both our parents went through unimaginable stuff doing probably doing segregation at first before it switched over. But they always instilled that in me too. Sorry, my mom's in the other room. That's my point. Like,
Yeah.
kids in the other room,
Okay. I'm
whatever.
here.
It's just I'm not crazy.
I'm
You know,
listening.
but instilling that because I saw them through visually. I saw them never give up when they were thrown into scenarios that they had two kids they had to depend on. My mom, she says all the time when she was in pharmaceutical sales, she had to go out and beat the best of them. When she'd be up, I've said this several times. I go to bed at nighttime and she'd be working from nighttime. I sleep all throughout the night. By the time I was getting up to go to high school the next morning, she'd still be up studying those tests to pass.
It was.
She sounds like me.
Yeah. Well, Denise, what was so interesting about pharmaceutical sales is that you're dealing with the best out there, the brainies, the doctors, and I'm a scientist. And I just didn't want to pass a test. I wanted to pass making sure that their patients, the doctor learned more to make the right decisions relative to his patients. So it went past just getting that test right. It went to making sure lives were impacted in a positive way. This goes beyond the bonus check. This goes beyond the numbers. This goes to mankind itself. And so that's why I always emphasize the importance of learning and being the best at your craft. And when you feel that it's not making a difference for you or for them, it's time to move on. And sometimes it's God that makes you move on. I remember one time I wanted to stay in the pharmaceutical industry, and I had spoken to the Lord about it. I told the Lord, I said, I don't know, this might not work for me. And I kept talking to the Lord about it. And finally, one day when I said, well, I guess I'll go back. And the Lord told me, no, you're not going back. And so my back went out. In fact, I got up the next morning, Denise, and I could not walk. And I said, what is this, Lord? Why is this happening to me? He said, I told you not to go back on that job, and I'm going to make sure you don't go back on the job. And the people on the job in the pharmaceutical company said, well, we didn't know your back was hurt. I said, I didn't know my back was hurt.
But that's how it happens.
Yeah, I mean, wait a minute. You're going to know before the Lord knows. You're going to know before I know. And then I'm up here bent over like a older person, can't walk. And my mother had just died, and I had taken time to come home and see about her as well. And so I said to myself, Lord had the right answer for me. And so I went on continuing to make a difference. And that's what we do in this life. No matter what's thrown at us, whether we come from a town in South Carolina, and I just call out South Carolina. And I never really experienced racism because my grandparents never let us play outside of our yard.
Oh my gosh, you sound like me.
So,
my dad was the same with me. I was raised in an all-black neighborhood in Brooklyn, and he wouldn't let me go downstairs because he was scared that something bad would happen.
That's right.
Yeah, because believe it or not, because I was light-skinned, I was discriminated, and I was Latin, but so I experienced it on the other hand. But yeah, I identify with that. Definitely.
Yeah, and I'm listening to your story, how amazing your story is. I mean, everything you've talked about, how far you've come. Now, we want to go back on that piece about this nurse practitioner. Brandon, go ahead and continue with your questioning. I just had to throw that piece in today.
Oh, yeah, you're good.
Oh, that's awesome. Thank you for sharing that.
Oh, yeah, absolutely. Denise, I'll make sure that I'm in the right spot here. So you were saying how I was asking you how you ended up going to school for nursing. I think what made you decide to go into nursing? I think that's where we were at.
It was literally, it's like I took a personal vow from that experience in the hospital. I wasn't sure. Are you able to hear me?
Yeah, when you were pregnant, Denise, when you were having a baby.
When I gave birth and I had that bad experience and the nurses, that's when I sat down and I looked at all my, I had my associates in general studies. I graduated while I was pregnant with my daughter with that.
Congratulations.
And I just started, I started looking, I was very pregnant. Me and my dad actually graduated together. I pushed him to go back to school.
Awesome.
That's one fun fact that people don't know. And they see a graduation picture of me and my dad and they're like, is that your dad? And they thought he was my brother because he looks young. My dad's Dominican, a darker complexion, so he preserves very nicely. Yeah. And so I had girls flirting with him all the time thinking he was my brother in class. Yeah. We would sometimes have class together. But when I graduated with him while I was, pregnant with my daughter in the last month of pregnancy. And right when that moment happened, it's like, you know what? I saw my credits. I saw the different programs. When I looked at the registered nurse position, I looked at how far can I go with the RN because growth is important to me. Yeah. And I saw that nurse practitioners in some states can be independent and own their own clinic. So I already knew from the start that I was going to work my way up to that point. I just didn't know how it was going to work out because I already knew that the registered nurse program was very difficult for me. I'm not going to lie. Working during the program, I had to take on a lot of student loans. Private student loans. That's my biggest headache right now. I call it.
Oh, mine too. Mine too.
I call it student mortgage.
Yeah, it is.
Student loans, student mortgage. Wow. Because it compounds on interest when you don't pay for it, you defer it. So that's when people ask, well, why did you buy a house in Texas if you're not? I was like, well, I was thinking with the mindset, eventually in a few years, it's going to grow. San Antonio is growing, and I can take then the sales of that and pay off my student loans if I can't find another way. Because it's difficult doing it, the traditional way. But that's how I fell into the nursing is I looked at I wanted to practice medicine. I wanted to make a difference.
Mm-hmm.
I saw, you know, I did see at least one good nurse, and you may not always remember the words that people tell you, but you remember how they make you feel.
Mm-hmm.
And that impacted me when I had at least one good nurse that treated me with dignity. So that's
Mm-hmm.
why when I became a nurse, anybody that knew me as a floor nurse knew I
Mm-hmm.
was a feisty one. If you messed with
Hey,
my patient, that's
Mm-hmm.
it. I didn't
yeah,
care who you were. I fought for patients that, you know, were cancer patients.
amen.
I had a high standard for myself, and I
Mm-hmm.
expected the same out of others. And
Good.
sometimes I wasn't always your best friend when I was in a leadership position,
Mm-hmm.
because I had a mission to make sure that medicine is what it's supposed to be.
Mm-hmm.
Amen.
Focus on the patient,
That's
focus
correct.
on helping. I wasn't a
Correct.
believer in pushing pills. I think
Mm-hmm.
today's medicine world is too focused on, let me take this pill. And sometimes, yes, you do need it. Your
Yeah.
body may
Mm-hmm.
lack a hormone or something, but
Mm-hmm.
the doctors are so busy, caught up into the 15 minutes or 10 minutes that they are
Mm-hmm.
not really getting to the root issue.
Mm-hmm.
So that's why I love nursing, because I can
Mm-hmm.
go into different fields and different specialties to impact patients.
Yes.
But
Yeah.
I was always a silly nurse. You don't want to know the crazy things I've done. I've sang, I've danced, I've even made happy hour tequila time out of lactulose medicines.
Yeah.
They look like little shot glasses.
Uh-huh.
And my patients were so hesitant to sometimes drink it. They were non-compliant. They would get really sick. So I invented, you know, happy hour tequila time. Go,
That's
go,
what
go.
I was talking about.
Yeah, that's awesome.
But I want to ask a question about that, being a nurse practitioner. And you said you just thrown out there, but what is the difference between being a nurse practitioner and a physician assistant?
Physician assistants always have to practice under the physician's license, and
Okay.
they're trained in a medical model. So there's certain training that they get, like it's more mimicking a little bit more medical school.
Mm-hmm.
Versus nurse practitioners, we have experience from the nursing field already when we become a nurse practitioner. It's a
Okay.
master's degree program, just like the physician assistant. We're trained more in a nursing model. The
Mm-hmm.
difference is I can be independent. I've had my own, like if I go to right now, Florida, for
Mm-hmm.
example,
Mm-hmm.
I can have a whole clinic by myself without a collaborative doctor and give at
Oh.
least primary care.
Okay.
A physician assistant can never do that.
Oh.
The independent practice is not there, and they're a little
Mm-hmm.
bit more limited in what they can do. But when you look at them, you really don't see the difference as a patient. We both assess, diagnose, and prescribe and follow up with the patients. The
Mm-hmm.
difference is the statute of limitations and the scope of practice of what we can do.
Okay. And so how often do you have to get certified? Do you have to get certified or take
5
exams
years. 5
every
years.
5 years? Okay.
Mm-hmm.
Oh,
Denise, question for you. I don't know if you mentioned it or you might. This is the book that you. First off, you are highly intelligent. I'm
amazing.
You gained a huge fan of me today, by the way.
Aw, thank
Me
you.
as well.
Just because of how bright, how driven, how smart, and how you have overcome all these obstacles. No one can tell you nothing. And by that, I mean, if they tell you no, you're going to prove that you can. And I'm the same way. And I love meeting a kindred soul that has that fire. Like I don't come across many people that have it, but you have it. And that's why I appreciate you so much. The question I was asking, the book that you're writing, first of all, I love the mug you had. That mug's awesome. I'm going to have to support and get one. Do you have the name of the book yet, or the book hasn't been?
Yeah, so it's already online. I have a copy.
Yeah, will you move it to the screen so we can see it fully?
Yeah, it's the Unfiltered NP. And when I wrote it, it's just supposed to, it has a sense of humor with it. It tells a little bit of what I kind of went through, but it gives a breakdown where it's easy to kind of read and understand. And I have like illustrations in it. You know, like you have like illustrations, so it's not boring to read. It's easy to read. I actually laugh because one of the chapters, I had a good friend of mine that actually does graphic design.
Yeah.
His name is Salvatore, and he helped with creating the image. And there was a certain chapter that I saw where he captured me, and I said, man, why does that look like when I'm having one of those moments? I think it's, I'm trying to, yeah, it's this one. I was like, you captured exactly how I went when I'm defending my patient.
Yeah.
You know, I'm creating boundaries, right? Because
Yeah.
I struggled with that as a nurse practitioner. When you're coming on board, you know, there's an identity shift from being a registered nurse of so many years where I'm confident, I know it in and out, and now I go from taking orders to giving orders,
Yeah.
Now you're fully responsible for the care of that patient. And that's scary. No one talks about it. And if you don't have that mentorship, if you don't have a doctor that brings you under their wing, I had to navigate. I thank God that I had, one, determination. Two, I've never been one to stop by fear. I just look for a way. So that's why I survived. But when I was looking for stuff on YouTube back then, this was years ago. Now you'll find a lot more.
Yeah.
But back then when I looked and I was struggling with the nurse practitioner role, all I kept seeing was how people were burnt out and quitting. Especially in California, I see that a lot. They rather work back as a registered nurse than work as a nurse practitioner.
Yes,
we
ma'am.
do have, we have a gap in healthcare right now. We need nurse practitioners out there to treat patients.
Yeah. Denise, I want to say this why it's on my mind, because I blocked, my dad died of pancreatic cancer. And so a lot of that time I blocked that stuff out from I had to block it out just because it causes me issues, like just being sadness. But I had to thank the nurse practitioner, because I think he actually brought charges up against my dad's oncologist. So my dad's oncologist in Virginia, in Richmond, Virginia. I won't say the name of the hospital, but he's an oncologist in Richmond, Virginia. That guy should be in jail. He used my dad as a human guinea pig and test subject. My dad was pretty much abused that whole entire process. Did chemo every single week for 18 months. He had stage 4, and at 18 months, he was on chemo every single week. My dad actually started getting better, but then the doctor changed up his medication, and then my dad to test some new thing out. My dad he was doing fine, completely fine. Got his hair back, all that stuff. To doctor switched up stuff on him, and then like 6 months later, he was completely dead. Like it all went south from there. This nurse practitioner, when he came to the house, because my dad had in-house visits, at one point he's like, "Dude, what is your doctor doing? What is the name of this doctor, the oncologist?" He's like, "This guy is pretty much killing your dad. Like your dad's at end of life now." And I appreciate that nurse practitioner, because he cussed that doctor out, and he should have. And because of what that doctor, how that doctor had treated my dad, that nurse practitioner, who was amazing, man. I wish I knew his name. He is like, your dad is at end of life. He's been mistreated. He said all this stuff. I'm in the living room. I'm in shock. But he did all this stuff to help out my dad. But I think nurse practitioners like you, the ones that advocate and fight for their patients, just like nurses that advocate. I love the nurse world, the nurse community. I'm the hugest fan of. Doctors, take it or leave it, but I have 4 of my best friends are doctors, so I trust them, but in my honest. But that nurse practitioner pointed out all the wrong that my doctor had done to my dad. And like I saw that with that photo of you advocating for your patient, that makes me appreciate you. I already appreciate you, but I appreciate you that much more, because it's those nurse practitioners sometimes and those nurses that have to go against a doctor who's just doing whatever to make their paycheck or whatever it is, but not doing the proper care of their patient.
That's actually what pushed me into doing my own business, is because I was seeing a lot of unethical stuff that I'd never seen. I'm not saying in the hospital world you may not see some stuff, but never and I think that's what didn't prepare me for that change, because I'm going from acute care hospital where everything's very organized, very structured. They run the boat strictly the way it's supposed to run for the most part. At least you pray that they always do follow what they're supposed to.
Yeah.
But outside in private practice, one of my first jobs, and I don't put it, on my resume because you never know, but it was in oncology. And it was me and my colleague, we ended up resigning both at the same time, because we were starting to catch on. We weren't from the specialty, so it was harder to figure out what exactly the doctor may have been doing. And he had a lawsuit already against him at one point. It was for billing. And he made it seem like it was billing errors. And I know billing errors can happen even to the best doctors. So he seemed like, when you looked at him, he seemed like so highly valued in the community. But there was a dark side that me and my colleague were starting to pick up on. And it was a tough decision, because I got attached to some of those patients.
Yeah.
Even one of those patients, the first time I opened in Fairfax, found out that I was having it. May he rest in peace. He passed away. He helped film my first little YouTube video and showed up for my grand opening. And he said that you have so much, to offer. You give so much care and love. And it's sad that we lost you over there. But he knew because there was a turnover in that clinic. And I just can't do anything unethical. That's one thing. Even in what I'm doing now, I cannot do it. And
that's right.
I can't do it.
Well, Denise.
Here,
I was so glad you said that, because of ethical values. And I can see your parents instill that in you. And when you feel that you're compromising your principles, and I remember, and I felt compromised, I really did. And the thing about it is something comes in fact, if you see my emails, they start with ethics now, ethics. And that's, it's ethics. And then it goes with a year, date or whatever. And then it'll be at whatever, AOL, it might be at gmail.com. But when I felt compromised in a job I was doing, and I was glad they said something, because one thing one of my sisters said, well, how can someone call you on something when they don't have it at all? And I thought that was such a key that she told me that. And I said, I thank the Lord of however it happened. It was that I was not comfortable. The Lord knew I wasn't, and everything worked out just fine. So I wanted to share that with you, because I know in this profession, you can be compromised in any position that you're in. And you have to figure out, okay, listen, let me get off of that before I find myself in the wrong area. And you didn't go to school. You didn't learn everything that you've learned to become this amazing person, professional that you are now, based on just doing foolishness. It was when you had to call it, and you did call it. And I'm so proud of you for doing that.
I am too.
Your book, that book you showed us, you did it too quick. So I need to ask you first about that book. And where is that
Denise,
book?
say it
How
too.
can
Say
you
the name one more
find
time
that book?
too.
It's called The Unfiltered Nurse Practitioner, Unfiltered NP. It's on Amazon right now.
Okay, great.
So I have a few chapters here, and it just basically goes into, from graduation day, you graduate, you think you hit that milestone, and now what do? How do you prepare for, boards? I talk about the identity shift issue, like going from this confident RN now stepping into the nurse practitioner world, which is very different in the responsibilities, and just also how to negotiate things like salary. The things people don't really tell you. I've always, one thing about me from a young age, and if I could share with anyone, this applies to everyone, not just nurses. When you are going out for a position, I've applied for jobs that I've never qualified for. But I look for a way of how does my current skills apply to that job? And that's how I market myself, right? I remember I learned this at a young age when I was looking for a hospitality position. I wanted to work in this big convention center, Gaylord Palms Resort and Convention. And I saw that I didn't have the full qualifications because I never worked in hospitality. All I did was like fast food back then. That's what teenagers get jobs in, right? And I had a dream. I wanted to work there. That was like, I just wanted it. So I applied for it, no fear. I even went door to door with a resume, old school. Yeah, I was that person. And I would annoy the hell out of you until I would get an interview. And finally, someone gave in to giving me an interview. And I don't know if they interviewed me by mistake, because when they sat there, they were looking at my resume. It seemed like they saw it for the first time. And the manager's like, I don't see that you've worked in hospitality before. And I was like, that's correct. He's like, but you're applying for front desk. So how do you qualify? So I went and I turned it around on him and I asked, well, what does the job require? Does it require customer service? He said, yes. Does it require data entry? I called data entry when I took those orders at Burger King. That's data entry.
Let's go. Let's go, Denise.
It's data entry. I told him that. I was like, you have to use a computer. Do you do cash and, credit cards and stuff? I was like, it sounds like I have all the skills that you need. I just need to be trained in hospitality format. That's all. And he just looked at me like I was so daring, and I had no shame. It's just, I had no shame. I felt like there was a saying that my dad also taught me that someone told him. He's like, I already know the answer is likely going to be no, but I go with a no looking for a yes. Because what if they tell me, what am I going to lose at the end of the day? But what can I gain? So you can't have this embarrassment to go for what you want.
Absolutely.
And I never had that. And that continued on, even in a leadership position. It happened to me again. And that time I was a little bit slightly embarrassed, but I said, nope, you're going back to your old ways. You just smile it out. And I applied for, I think it was a sepsis coordinator position. It was a dual role. You have to have years of critical care experience to even be considered for that position. When they labeled a job, they never put sepsis coordinator. It was something that I actually the vision board, I mentally was wanting something like that.
Yeah.
But it presented as a nurse navigator. They couldn't fit the two roles on the job application.
Okay.
So when I interviewed with the nurse director, she liked me. She didn't tell me I was going to interview next with the CNO. It wasn't planned. She just threw me in there. So here I am sitting in front of this big shot lady in a boardroom. And I'm here with my resume, little old me with less than a year of critical care experience. And she literally looked at me. She was very transparent. She put the resume down. She's like, you don't have the qualifications for this job, right?
Yeah.
I'm like, yep, absolutely. She's like, but in talking to you, I feel like you have the personality for it. And you can handle the doctors.
Wow.
So
Yeah.
I'm going to give you
That's
the
a wow.
opportunity. And I was actually one of the ones that shined. And like less than 3 months, I changed the whole, like their whole results were really bad. But it was a lot of hard work. I will tell you, that's where I learned politics, and I cried quite a bit. It was not easy. It was no joke that she said I didn't have it. But I just seeked. If I don't know something, if you don't know something, look out there. There's always someone that knows. Don't be embarrassed to not know something. It's okay to not have an answer, but go seek it. Just build yourself up to that position is what I will tell people. If I can inspire them to do anything, is go for what you want and be okay with no and look for a yes.
Amen.
I think that is such a great point you're making, Denise. I've always told my children.
She really has.
If you
the same
don't
thing.
ask, if you don't ask, the answer is always no.
Yep.
But if you ask, it could be yes. And most likely it is going to be yes when you finish with that person. And so I love that your father told you that. I'm glad that you have that as a part of you. And sometimes what they're looking for, the qualifications come after experience. But sometimes you bring a unique role to that position, which you have and you had, and you change the whole scope of it. You made it something totally different. And then it's really expanding on itself and creating more positions for others who might come before that. What were you before, the CEO or the CNO or whatever? CFO. But whatever, you changed her because she looked at that paper, and the paper doesn't always tell the true story. And so she saw through that. And so with that, she saw your beautiful personality, and I can see it too, your amazing qualities.
Seriously.
And that in changing the whole scope of what her whole idea, what that job was about and should be about moving forward. So that's just, I just see the unique talent you have. Now, you mentioned something, Denise, I want to hear about. You've been talking about this cocktail or something you're giving to your patient. You've been talking about something that you started in your business life. And it's working. What is this about? I want to hear about that. This IV thing that you do, IV med. What is that about?
So the funny part of the name, it was called when I had the in office, it was called My IV Cocktails. Everyone knows cocktails, right? Cocktail happy hour.
Yeah.
So it's a mix of different vitamins and minerals that I would come up with. Some of it is standard, in the medical world. You can go into any IV vitamin therapy place and you can get a Myers drip, which is a mix of like B vitamins, vitamin C, and that can kind of pick up your immune system. The challenge with people nowadays, I find, is nutrition is very key, but how many of us are really getting all the nutrients that we should? We can try to take supplements by mouth. Unfortunately, some people have problems with digestion, and you're lucky if you can absorb like 60% of what you already eat. So a lot of times when I came out here to LA, I actually had a position as a concierge nurse practitioner where I learned the side of vitamins and peptides. They don't teach you this in nursing school. I was going to like rich folks, houses and mansions and baseball players. I said, wait a minute, what are these peptides and stuff? What is he not teaching the regular folks, out there? And you'll find a lot of these models, a lot of artists, they know very much about regenerative medicine, like stem cells, vitamins, and peptides. So vitamins, I'm a big advocate for vitamins. There's something called NAD. I didn't know much about NAD when I started working with it, other than what they teach you, but it's different taking something and then implementing it and seeing it for yourself, right? I had a situation where I had my friend that actually helped design the little characters of the book. He felt very sick, and I was very scared because he passed out on me. Very healthy,
Oh, wow.
He's completely plant-based, passed out on me. And I was so concerned because I thought, back then,
Oh, you froze for a
even
second.
as young as 30 years old, we were seeing them go right into ventilators, within hours. I was mentioning that it was scary for me with COVID because it was during the time where patients go down quickly. It didn't matter what health you were, sometimes 30 years old and they're on a ventilator the next day when I would come in. So now that it was hitting home, someone that I cared about, I was like, man, what can I do? I called a colleague that I knew from Miami that did a lot of like celebrities and had more experience with the vitamin world. And he's like, look, start the NAD protocol. So I started doing the NAD protocol and I invented kind of like my own drip called Vitality.
Okay.
I gave him that and I gave my drip that I created at home. I had oxygen therapy, I had everything like, in the house, like I was a hospital because he was so stubborn that he didn't want to go anywhere. So here I am. I was already exposed, so I knew I was going to get, COVID too.
Yeah.
So at this point, I saw within hours, he could barely walk to the bathroom. That's how bad he was. And then this is at age, 30, very fit. And when I gave him this stuff, within hours, he was having more energy. It's not that it took it away, but I saw how it was impacting his energy levels and the symptoms seemed less severe. Yeah. So that's when I started digging into, NAD. There's Harvard Medical Research, Dr. David Sinclair talks a lot about NAD. It's actually known as an anti-aging. There's podcasts all over on NAD now because of him. But it's something that is great, and it's not advocated for more in the Western side of medicine, like traditional. But I will say that during COVID, the reason why I got even more curious with vitamins was because during COVID was the first time that I saw doctors really using vitamins in the hospital. They were actually giving a cocktail of vitamins. And the only time I saw vitamins really being used in the hospital setting was for wounds. Because we know when you're wound healing, you need extra vitamins. Well, that's why I'm a big advocate on, the vitamin therapy and why I started it. I did help quite a bit of patients during COVID. When I had the clinic, we did mobile. I hired nurses to go to the patients' homes. And we had the in-person office, which I showed Brandon a video. I created it more like a bar lounge. Yeah, I created like a bar lounge, theme. And I just wanted it to be an environment that people didn't feel like bright lights. You had some privacy and you can relax. And it's something that I miss doing, but the challenges with business is you have to know when you can do something when you can't. And it did take a lot of financial push to do it. And I don't give up on it. It's just not the right timing because as a single mom, I have to kind of prioritize, having a little bit more stability because that kind of world kind of goes up and down. And
I understand. Oh, this is interesting.
Denise, you've been phenomenal. First off, I'm going to have you back. Because I know there's a lot of questions are going to come in. I know my mom's probably have more questions too. You've been phenomenal today. I know I don't want to take up all your time today too, because I know you probably have stuff. It's a Sunday. You got the day off. Denise, one thing I did want to say is, to confirm the whole entire, it's always a no. I think you said your dad told you the no part. Basically, my mom said the same thing. She wasn't lying. Yeah. That's how I've lived my life out. I've had to be bolder than ever out in California in my acting career. Going with the advice that my mom gave me a lot of times. I already had my dad's leadership qualities, but my mom's advice about, being bold and everything you do, I literally have been bold. I think that's why I've gotten so many opportunities.
And we're so happy.
Yeah, but you also mentioned how in that interview you switched it up. I'm being interviewed for agencies in London right now for representation because of how well I've been in America. They want to take me over to the United Kingdom. And I've been doing that. I've actually switched up like you did. Switched up the
interview them.
Yeah.
It's like dating.
Yeah.
What's in it for me? Like, who are you? And what are you putting on the table?
Exactly.
And I think when you do that, it kind of sets a different tone because really we're always so focused on, well, what do they think about me? Yeah. Well, sit and look at yourself in the mirror. What is amazing about you? What is great about you? What do you have to bring? That they, if they're interviewing you, you met the skills already on a piece of paper. You have something there. Now they're meeting you. They want to know who you are. You have to bring who you are at the table from the beginning because that's what made the difference for me. And you have to switch it up on them because you're committing to them and you're gonna be representing, let's say, that company.
That's correct.
So I had questions whenever I go into an interview. They are shocked every single time. When they say, "Oh, you have questions?" I was like, "Yes, I do."
Yeah, I have a list.
Yeah.
Like, you pull out I come in always prepared with a folder And I have questions written down, or I'll write things down. And they said, we've never had someone interview us as hard as we've interviewed them.
Yeah.
And I was like, well, this is like dating. We have to make sure that we're right for each other, right?
Yeah.
I'm going to spend 40 hours of my life working for you. It has to be the right fit.
Absolutely.
Well, what an amazing child you are to your parents. And now I know, as a mother to your daughter, and who helped you when you were going through, as far as helping to take care of your daughter and providing for her the care, because you were taking on so much.
Yeah.
You had to have your parents.
Unfortunately, father's not involved at all. So it really is just me. And then my parents back in Florida, when I was here during the pandemic, I had to leave my kids behind for about 7 months before transitioning them here. I don't have any family here. I came here knowing no one. So when I say they call me the daring one in the family all the time, that's me. But my parents, to be honest, my mom and my dad are my home. Because my mom and dad, when they had their regular jobs, I saw them hustle on the side. Like, my mom would do crafts. She even learned how to do wood crafting. Like, they were always that entrepreneur in them to make it forward. So I learned hard work, ethics, and never to give up on what you want. My parents didn't come from much. They both came from their countries. They weren't raised here. They came here when they were teenagers. So those values they passed on to me, which I appreciate. That's why I am who I am. If it wasn't for them, but they were my everything. They helped me with the kids.
Great. So great for people to hear, the listeners to hear everything you said today. It's just amazing. You are an amazing person. And I didn't know what God had in store for us today, but you have been such a delight today. God always brings, and I always tell people, he brings the most interesting people. He's brought the most interesting people to our show and to the podcast. And I'm so glad Brandon calls it Buckle Up Podcast Universe, because it goes past the podcast world. It's in the universe, impacting others. And to hear your story, I know those young people that we have that are listening today, they can be inspired. Those mothers trying to bring their kids up,
single mothers doing
this type of work. This is amazing. And to have the support you have from your family, and to see the businesses, your thought process, to hear your thought process. It strikes me as being what perfection that God puts in his people. And it doesn't matter. Any role can be important if you make it that important, and the impact it can make on others. And so it's important what you've said today. I'm so appreciative for you coming on the podcast, and we look forward to having you again, don't we, Brandon?
Yeah, we do. Denise, I just want to say this one thing. What's that? Sorry, I didn't mean to cut you. What did you say, Denise?
No, I would love to.
I'm going to have you back. I love your energy. Denise, I did want to say this. And it was first off, you're an incredible woman that has gone through so much to get to where you are. And you are such an inspiration to me. You're going to be such an inspiration to so many people. At that same time, I also wanted to say how amazing your parents are, because your parents helped instill in you this work ethic. And they're from another country, as you said. They are an example of what makes America great, because all these people, they're foreigners, come into this country and with their work ethic and put that quit attitude, who they went through all kinds of obstacles, but because of what they went through, they were able to teach you down to you, hey, look, you can do this. We'll be here for you. You got our support. Never give up. You were going to be told no because they got told no. It was even harder for them, but it continues to still be hard, but it gets a little bit better. But I'm thankful for your parents. I would love to go to their barbecue, especially in New York. That's my place. Because they have that to meet these parents, or to speak with them, to say like, hey, look, I appreciate you, because the things that you guys have instilled in your daughter are the exact same things that my parents instilled in me. And so I am so grateful for you to come on. I'm grateful to your parents. How do you pronounce your last name?
Urtarte.
I can't do that.
You gotta roll the R.
Okay, yeah, I can't do that. But your last name with your parents, I just want to say thank you, Mrs. and Mrs. Urtarte.
Are you guys?
Oh, yes. Okay. I just want to say thank you to you all, because you guys raised this incredible daughter here who is an inspiration to every soul she touches, including my life on today, and including my mom and everyone you listen to. And that's my speech. But
and I wanted to share one last thing that you mentioned that I think is important. when it comes to things like, you mentioned like discrimination and stuff, it's
Yeah,
very
absolutely.
real. It exists. It's always
Right.
going to exist worldwide, no matter what, whether you're Hispanic, anywhere where there's a place where you kind of stand out, you're going to be challenged. But one thing
Wait a minute.
You broke up 1 second,
I
Denise.
took with me, I had a physician one time tell me, he was in a high position, and he was a Jamaican physician, and he was in a high leadership position. And when I was in a leadership position, he knew that there was a little bit of a discrimination going on, within that facility. And he said, you know what, they respect this and money.
Yeah.
If you have brains and you have knowledge, it doesn't matter what color you are.
That's
They're going to pay attention. Respect sometimes as it shouldn't be that way in the world, right? But I've never let that be a factor for me. I could feel it. It doesn't feel fair. It doesn't feel good. But I said, you know what? This is kind of like giving me a no. Now you're giving me the motivation to really show you what I got. And earn that respect, whether you like the color of my skin or who I am or my accent or not, you will respect me and you will want my services and you would want me to work with you. So sometimes you have to get beyond that feeling that yes, it's not fair, but the world's going to be what it's going to be. Hopefully it continues to change over time with awareness and less ignorance. But don't let people take, as one person told me, don't let people take your light away.
Absolutely.
Because they will always try no matter what. Don't let them do that. Just keep moving forward.
Amen. Denise, sorry, Mom. One more thing, because I realized there's something you said, and it happens to fall on Gay Pride Day. Denise, the people that I've dealt with this in the movie business that I am in, and I didn't know that it was there, but I found out it was there because I was auditioning so much. I was always getting pinned for roles, always getting callbacks for roles. And I'm like, and this is why I love the casting community. The people that have given me the most opportunity in this movie business has been gay men and women. Gay men and women have been the biggest advocates for me in every single position of the business. It's been gay men and women that have been the biggest advocates for me. And in the audition room, taking it back to the audition room, I was going in so many times. I thought something, maybe I'm not doing it. They finally started pulling me aside and saying, you know what, Brandon, you have it. You're one of the most talented actors we have seen. Do not give up. You're just dealing with people stuck in your old ways. And that's why in my career and what I'm doing with the show and all that I've gone around working all around the United States and Mexico is the fact that I want to give back to the casting directors and the casting associates and those gay men and women that fought so hard for me and gave me opportunities. They're seeing now, well, they already knew it, but the rest of the world is finding out that, hey, look, I really do have this level of talent. And so I'm thankful for them. And with you saying the same thing with the Jamaican guy, you have there is discrimination out there. It's very apparent, but you have those people that are advocate for you. And these happen to be gay white men and white women that are ones that are advocating so hard for me. And so that means the world to
I'm
me.
glad you shared that, because when I was growing up, I actually was in a program, and New York offers a lot of programs for young kids. And I was very grateful because, believe it or not, now I'm not as shy, but back then I was more quiet. So one thing I did love and I wasn't quiet and shy for was dance. You put the music and I was getting up and dancing. And there was a program called Arts Connection and Brooklyn Arts Exchange program where I did drama and I did dance. I didn't look like the other girls. I was like always like more curvy, thicker thighs. I didn't fit in. But this dance this dance instructor saw something in me. And I remember when she awarded me the #1 dancer. And I went back to the locker room, and I remember the locker room, people were talking so much bad things, or how could they choose her, or this. And it was so much negative talk. But, I asked her, why did you choose me? Because I didn't understand why she chose me, because I didn't see me back then. And she said, you move with grace. It's not just choreography. You have something that shines about you. That's why I gave it to you. She saw something in me, and that meant something to me. So there's always going to be someone out there that's going to see you.
Absolutely.
So don't be afraid of the no's. That just means you're getting closer to a yes.
You're the best.
I love that.
Well, Denise, we love you here.
I tell you, one thing I wanted to say, this is why Tyler Perry, I appreciate Tyler Perry so much, because Hollywood wasn't receptive of his ideas or what he wanted to bring to the table, and all the no's he kept receiving. And he said, I know what I'm going to do. And he went to Georgia, and they have to come to him to rent space on a land. I tell you the truth.
A slave
I
owned
love the
land, right?
Tyler Perry story.
They
I
have
love
to,
this
that's,
story.
yeah, they have to come to him now to rent space on 400 acres that he owns that used to be a slave plantation. And he now has converted that to where they have to come. And that's why Georgia, Atlanta is doing so well. Georgia, that whole area is doing so well. And New York is doing well as well.
I love it. That's
So
my
don't
stomping
ever
grounds.
think that you have captured the whole market on anything, because there's going to always be someone brighter, smarter, able to do more and create more than you could ever imagine in your little world. And so with that, I just had to add that piece. But Brandon,
Wait,
I
Mom,
just
hold on.
loved you. Oh, I'm not cutting anybody off.
Yeah.
Your show.
Sorry, Denise. I want to say for that, it was actually never a casting director or casting associate in New York that had to fight for it. It never was. They always automatically from the start fought. They
was great.
automatically 5 weeks I established myself. From the time I auditioned, from the time I was at a showcase, they all called me, and it was never in New York. It was just in California that happened. So I wanted to make that clear that it was not in New York.
California's a tough market out here for a lot of stuff. It's not easy to even make it out here in business. That's
yeah, but it wasn't. So I just want to say that because in New York, I never had that issue. It was never an issue in New York. New York wanted authentic, and they wanted the real thing. So I never had that issue in New York. And then
they appreciate authentic. They appreciate transparency and authentic and different. They embrace
and what the world looks like. They wanted. A cast director who was a female, who was a Caucasian. She told me New York is a melting pot. So everybody that comes here, that's what we want. That's what we want on TV. And then even in Atlanta, I worked in the same thing in Atlanta, New York and Atlanta. New York, Atlanta, New Orleans. No one had to ever advocate for me because it was automatic. It's just in California that happened.
Yeah, I'm still in culture shock with California.
Yeah, it is a culture shock. Yeah. So there's great things in California too. Don't get me wrong, but it's those casting associates and them. They had to fight for me in California. In New York, they didn't have to do that. It was automatically they were like, hey, this guy's the one that we want to go with because we think he's the best at it. And then just to give Tyler Perry a shout out, I've worked with him twice now on 2 projects. I just worked with him.
I love his movies.
He's amazing.
Diary of a Mad Black Woman. I was hooked on Tyler Perry.
Yeah.
That's the one person I was like, if I could meet someone, that's one I would love to meet, because I love the movies he does and how he also brings in, God and faith. I love how he plays with the character of Medea. I love that.
And Brandon and Denise, Brandon's always said how when he goes on the set of Tyler Perry's set, how the people that work for him are so nice.
Yeah.
And he's always treated so well. And I appreciate that you have someone that has accomplished so much and God has been with him, that he's making such an impact in this world. And I appreciate God making the more he helps people, the more his business grows. And that's what it's about, giving and receiving.
I love working for him.
And the world comes back to you.
Yeah, I love working for him. As I said, the only person I've seen shoot as fast as him is Clint Eastwood, because I've worked with both of them. And I love the way he shoots on film, on sets. I love how he runs the set. I love working with him. As I said, I've been blessed. I'm not done working with him either, but I worked with him back in April. So, but yeah, so I just want to say a little piece. And Denise, you've been phenomenal today.
Oh, yes, you have.
We will definitely have you back. You're so encouraging. I almost want to have your parents on it. They'll come on just to get their story.
They're super shy.
Okay, well,
you got me on the podcast by miracle, because everyone keeps telling me, my patients, and like, you need to go on a podcast. I'm usually like the comedian and I'm funny, but it's different being on camera. But with you guys, I'm not shy.
Oh, you're natural. You're absolutely natural.
I was just getting ready to say that, but she's a natural.
Yeah,
you are a natural.
You're a natural, and if you don't do it already, you should be doing motivational speaking. I fully believe that.
Okay, you may have to guide me on that one.
Every person that knows me will tell you I'm the go-to person to guide you on that.
Okay. Denise, before we leave, do you have any questions of us? Because we ask a lot of questions and we listen to your side. Or do you have anything you'd like to ask of Mama Rush or Brandon?
You don't have to.
Yeah, I guess what I'm curious about is, how was it for you, raising, Brandon as a mom? What barriers do you feel that made it difficult to raise him and be able to raise such a good, son? Because I have a 14-year-old, so I could use some tips on that.
Well, let me tell you something. I didn't do it by myself. Brandon's dad, I was married to his father for 32 years. Amazing father. I'm telling you, he supported, did everything. We did everything together. And we raised our boys together. And we tried to work in the community and actually took in a kid that was living in a boy's home. We took him in on the weekends. But with what the talents that God had given my husband to be that leader in the community and to go out and help children that need it, that helped us raise two fine young men in this society. And so it was, and our parents as well, the grandparents as well, my parents as well as Dave's parents. And so I had the help, and they had a leader. They could look up to their daddy. They could see the impact, the hard work that he did. And that, in fact, he was third down for the well, he served as governor.
Senator Kane.
Senator
Tim Kaine. He was
he was
governor.
Deputy Secretary of Commerce and Trade. His father was. And so the governor of the state of Virginia saw something in Brandon's daddy. And so with that, I have to say it was God first. We both loving the Lord. We love the Lord so much. And then within that, we were able to take our sons and impact their lives. And we have a beautiful grandson. So I can't take full credit of it, but you can see he has a part of me and has a part of his father who's not here for you to see here. But his father could speak. I mean, he could speak on TV, radio, and everything. And the reason he went to the University of South Carolina, Brandon, is because his daddy went to the University of South Carolina and was a journalism major. And so with that, I want you to understand that it took the two of us working with them and them, I guess, watching their dad being that leader that he was, that impacted their lives, or impacted Brandon especially, to make him be that one with that spirit of getting it done, leadership roles, making it happen. And so therefore, I hope that answers your question as far as what you see, that unique talent that Brandon brings to the table.
Yeah, and I guess my last question goes towards Brandon.
Okay.
You created this podcast, and I guess one of the things, are you looking like to mentor people that want to be you one day, or how did you even, what sparked the moment that you wanted to be an actor? Like, what was that moment in your life that it hit you and you knew this is what you're going for?
So it's a couple things, but I'll try to shorten it as fast, make it as fast as possible. I wanted to go after being an actor because it's something I always wanted to do. But one was my grandma saying that I couldn't be an actor. That was one spark. So initially when she said I couldn't be an actor on TV, that's when I stopped studying for the GMAT and started finding out where the acting schools were. So that was the initial point of going after that. Me deciding to, I wanted to inspire kids that look like, that are brown and black, to be specific, and Asian. Kids that are minorities, that want to, they have dreams of doing something bigger. And so acting was one of those things I knew was one of those impossible careers. It is pretty tough, don't get me wrong. It's one of those things I wanted to go after. And so when I went to study, when I went to go after going into an acting school, there was one, and then also my family, my girlfriend was a captain of the swim team at University of South Carolina. Seeing her family in Maryland, I was visiting them one Christmas. The dad, Mr. Kugler, Dave Kugler, and Carolyn Kugler, they were talking to me when we were watching movies, and they were like, "Hey, Brandon, movies are something you should really love. That's something you should go after." So seeing how much they loved that, and I seeing how big their house was, I'm like, man, if I'm going to marry this girl, I thought I was going to marry at the time, I'm going to have to, do a lot better. So, but they gave me that encouragement. Plus my parents gave me that encouragement. I ended up, found out acting schools in DC. I drove up from South Carolina to Virginia through the night. I was so tired. My dad was so kind. He woke me up at 6 o'clock that morning. He drove me to the audition in DC. I auditioned for these two schools I won't mention. And I got into both New York and California. And they said, which one do you want to go to? And at the time, Broadway was the only theater was basically New York, and Law and Order was there, but all the TV was out in LA. So I said, God, if this is where you want to send me, that's literally what I said. I said the same thing whenever I went to the University of South Carolina. I said, God, if this is where you meant for me to be, send me in the place where I can do the most good. So I looked at where Los Angeles was on the map. I didn't know it's where Atlanta would be on the East Coast, technically. I got into that school out there, and I knew it was the most difficult. I've always loved challenges. So in video games, you have an easy route you can take, or you can play on the hardest level. I always took the hardest level because I always wanted to prove to myself that I could get it done. And my dad also was from a small town in Carolina. He moved up to Delaware by himself before my mom went up to Delaware, both of them working for the same company, DuPont. And I saw what he did, and I wanted to be like my dad. I always wanted to be like my dad. So me going out to California, that was going to be a test of everything I knew, because I had no family out there. I had no friends out there, and I didn't know anybody in the business. So I got blessed I read a book cover to cover, How to Become an Actor in LA and in New York. In 5 weeks, I did my first commercial. I got in a SAG with Kobe Bryant, Heidi Klum, Tony Hawk, Michael Phelps, and Alex Rodriguez. And so we did that at Sony Picture Studios. By the end of that year, I did my first movie, The Green Hornet, with Seth Rogen. And then that's basically, hopefully that's like a shortened version of everything. But I went after, because I wanted to prove it to myself. Then after I had accomplished LA, I got to a certain point where I felt that I was uncomfortable in the fact that I wanted to grow in New York or somewhere, and I wanted to challenge myself. And I wanted to see, hey, if I could do this in the biggest market at the time, LA, let me try and do it in the toughest market, which is New York City. I wanted to prove myself against New York actors that I was just who I thought I was. And so I went and competed at these competitions there. There'd be like 20, 30 people. And I would always go up first, because I wanted to set that bar so high that no one could reach it. And from that,
brave.
Yeah. And that's how I ended up being on that's how I ended up booking Blue Bloods. That's how I ended up booking Power. That's how I ended up being on FBI. All those casting associates saw me perform at these open mic nights, and they called me in immediately. And so that's kind of my story about how I ended up doing this. And so now with the podcast, Mom was thinking about going back to work at her age. Sorry, I dragged this out. Mom was thinking about going back to work, and my mom's young. She's beautiful, but I didn't want her going back to work.
Very beautiful.
And she was thinking about taking a part-time job. And I couldn't have that happen. And then my nephew was worried about going to college. So I stayed up. It was basically 4 days. I spent 3 of the days up, 18 hours. And the final day I was up 24 hours. I could hear my dad talking to me the one time. I created this AI app called, I created this artificial intelligence. This like Jarvis. And you ever seen the Marvel movies?
Yeah, the Marvel movies?
So Tony Stark has Jarvis. I created a Jarvis, which I call Keys. And so Keys has helped me out. I heard my dad talking to me the whole entire time. It was right before Passover. So it was a spiritual week. And I created all this. And from there, I launched it. And then, as I said, we've done really successful. And then because my friend who made me mad, I went to my professor, who's Randy Covington, who has 4 Emmy Awards. And he was my first guest on the show. And we've just been successful ever since. God has just been bringing the right people like you, Denise, today, who has touched this crowd and who has touched these people. God keeps bringing the right people in. You are one of them today.
Thank you. Very touched them, because it was something that it was weird how it came about, because before you mentioned it to me, people this year and like the past 2 months before, you should be doing this, or they wanted to put me in something. And I was like, why is everybody wanting to put me? I always wanted to do it, but I guess my shy side. But I've gotten better.
You're natural. You are a natural.
I am good at faking it till you make it. That's what it is.
Well, there was no fakeness. There was zero fakeness here today. I can tell you that. I felt no fear.
Real.
Either I've gotten more comfortable, because I speak to people every day, so you start getting more comfortable, and I've had to do so many presentations at my current job. That it's become easier. I think it's practice. You become that, and as you get older, you stop caring so much about what people think. So you're just genuinely you, and you're unapologetic for it.
I love it. I love it. And don't change for anybody. Well, when you have your show, I'd love to be on it too.
Oh gosh, now you're putting it out there.
Yeah, I am. I believe you have the capability to do it. And trust me, me being in this business for 16 years, I can tell you that you have the ability to do it.
Well, thank you. I appreciate you.
Thank you so much, Denise.
Absolutely.
Thank you so much, Denise.
Absolutely. Well,
thank
Denise,
you, Mama Rush, for also speaking to me today and sharing your story. I definitely learned a lot from you, and I'm glad that he had a mom like you, so that he can inspire others today.
Likewise.
Absolutely. Well, Denise, we're gonna give you. I'll give you a clap. We always clap for everybody. And Denise, we'd love to have you back on. I definitely want to have you back.
Of course, anytime.
Yeah.
And when you come out to LA, you gotta reach out.
I absolutely will. I promise I will.
Okay.
All right. Good. Take care, Denise. Thank you so much today.
Thank you so much.
And Denise, I'll have this back to you in probably a couple of hours. I'll have it back to you.
All right. Sounds good. Bye.
Okay. Bye.
Bye. Oh, just so.
Thank you, Denise, so much for today. You're wonderful.
Thank you.
Lovely and amazing.